Ever wondered why a respiratory examination holds such importance in medical practice? It's more than just a routine check. A respiratory examination can reveal a plethora of information about a patient's overall health, and it's a crucial component of the diagnostic process in many diseases. Let's delve into the intricacies of a respiratory examination. We begin with a general examination. The patient's appearance can often offer the first clues. Noticing features like pallor, which is a pale color of the skin, or icterus, a yellowish pigmentation of the skin, can indicate underlying health issues. Cyanosis, a bluish discoloration of the skin due to low oxygen levels, can point towards respiratory or cardiovascular problems. Lymphadenopathy, the condition of having enlarged lymph nodes, can be a sign of infection, autoimmune diseases, or malignancies. Clubbing, a deformity of the fingers or toes, is often associated with chronic respiratory or cardiovascular diseases. Observing the venous pulses can help assess the functioning of the heart and the volume status of the patient. Moving on, the examination of the chest is a key aspect. It starts with an inspection to observe the shape of the chest. Common abnormalities like pectus excavatum, a sunken chest, or pectus carinatum, a protruding chest, can be indicative of certain conditions. Observing the rate and rhythm of respiration can hint at respiratory diseases. The measurement of chest expansion is crucial to assess the lungs' mechanical function. Symmetry in chest expansion and movements of the chest wall is the norm, and any deviation can signal a problem. Next, palpation is performed to locate the apex beat and the position of the trachea. It helps in assessing the heart's position and size, and any shift in the trachea's position. Checking for the expansion of the chest and vocal fremitus, the vibration of the chest wall produced by speaking can provide valuable information about the underlying lung tissue and pleura. Percussion, a technique involving tapping on the chest wall, can help distinguish between areas of lung filled with air, fluid, or solid tissue. The sounds produced can aid in diagnosing conditions like pneumonia or pleural effusion. Finally, auscultation enables us to listen to the normal and abnormal breath sounds. Normal breath sounds include vesicular and bronchial sounds, while abnormal sounds include wheezes, crackles, and pleural rubs. To summarize, a respiratory examination is a comprehensive process that begins with a general examination and proceeds to more specific assessment techniques like inspection, palpation, percussion, and auscultation. It provides invaluable insights into a patient's respiratory health and can be instrumental in diagnosing various conditions. So, the next time you undergo a respiratory examination or perform one, remember the significance of each step and the wealth of information it can reveal. In the previous sections, we've discussed the various steps involved in a respiratory examination. Now, let's delve into some of the common respiratory symptoms that you might encounter. Firstly, dyspnea, or shortness of breath, is a common symptom that can be a sign of various respiratory diseases such as asthma, COPD, or even heart disease. It's important to take note of its severity and any triggers to help in diagnosing the underlying issue. Next, we have coughing. This is a common symptom that can be caused by a multitude of factors, including infections, allergies, or chronic diseases like COPD. A persistent cough should always be investigated further. Chest pain is another symptom that should never be ignored. Although it can be a symptom of less serious conditions, it could also indicate serious conditions like pneumonia or a pulmonary embolism. Wheezing, a whistling sound produced during breathing, is often associated with conditions that narrow the airways such as asthma or bronchitis. Lastly, hemoptysis, or coughing up blood, is a symptom that requires immediate medical attention. It can be a sign of serious conditions like lung cancer or tuberculosis. Being aware of these symptoms can help in the early detection and treatment of respiratory diseases. Remember, recognizing and understanding these signs is the first step towards effective treatment.